Welcome to another edition of A New Me. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location at Asman Eye Care Specialists in Timonium, Maryland, discussing the latest treatment options for dry eyes with one of this region's top eye care specialists, Dr. Erwin Asman. Dr. Asman graduated from the Illinois College of Optometry and has been in private practice since 1977. He has received many awards for excellence in optometry, including recognition for his participation in the Vision USA project, and he is a member of the American Optometric Association and the Maryland Optometric Association, among others. Welcome back, Dr. Asman.
Well, thank you for having me back again. I do appreciate your time.
Oh, it's our pleasure. I wanted to begin by asking you if you can please tell us what the dry eye syndrome is.
Well, dry eye syndrome has evolved throughout the years, being defined many different ways. But recently, the latest definition is it's a multifactorial, meaning many things can cause it, disease of the eye that can cause visual discomfort, meaning visual disturbance or blurry vision, and also eye discomfort, patients complaining of discomfort, okay? Now, it's also associated with a term called osmolarity, which means salt content of the tears, meaning the more salt there is in the tears, the more the eye will burn and sting and become irritated. So that's a general definition. Now, years ago, the definition did not include visual disturbances. So today, many patients that we see in our practice that are complaining of blurry vision, it's not just a refractive error, meaning they're nearsighted or farsighted. It could also mean they have a dry eye.
Very interesting. See, I wouldn't have put those two together. I would not think that blurry vision could be a result of the dry eye syndrome.
Right.
That
and
you
most
touched
patients don't put it together, and unfortunately, most eye care practitioners have a hard time putting that together also.
Now, what risk factors would you say, Dr. Asman, contribute to this problem?
Okay, the number one risk factor is, there's a whole host of them, but number one is being the gender being a female, the aging process, medication such as hypertension medication for diabetes, thyroid problems, systemic issues can cause it. People that use a computer a lot, people around computers all day long, that can intensify dry eye syndrome. The environment itself, working next to a heater, okay, or air duct, air coming out can cause it also. Chemicals in the environment can cause it. So a whole host of things. And on top of that, if a patient wears contact lenses and it's not fitted properly, a contact lens can actually induce some dryness. Patients that have had laser refractive surgery can induce dryness also, or even cataract surgery. So those are the main symptoms, with aging and being a female on the top of the list.
Very interesting. And I wanted to ask you, Dr. Asman, how common would you say the dry eye syndrome problem is for the viewers?
That's a great question. And the studies have shown, depending upon which studies you look at, it ranges from around approximately 20% to 60% of the U.S. population have dry eyes. But the dry eyes really varies between a marginal dry eye to a severe dry eye. Most people that have dry eyes have somewhere between a marginal and a mild dry eye. That's the majority of them, okay? And a very small portion have very severe dry eyes. So now the other factor is, the older you get, the greater chance you have of dry eyes. So the older population might have a 70% chance of getting dry eyes.
It's a significant number indeed.
Very significant, and it's considered an epidemic at this point in time.
What would you recommend as successful treatment options that are available, Dr. Asman, to take care of the dry eye syndrome?
Well, today we have a lot of treatment options out there, and the treatment options truly depend on the type of dry eye you have and the severity. Let me give you an example. There are two general categories of dry eyes. One is called evaporative dry eye, and one is called aqueous deficiency.
Okay.
Depending upon which dry eye you have will determine how we treat the problem. Okay. And then depending upon the severity of those problems, that also helps determine how we treat the dry eye. As far as options in treatment, once the evaluation is done and we go over all the possible ways of treating it, most options will range from prescribing over-the-counter eye drops, and there are many different types of over-the-counter eye drops, and depending upon which drop is best, we'll prescribe. Some patients will need prescription eye drops. Some patients need oral medication. Some patients need a procedure called lid hygiene, which can range from a thing called lid expressions to just keeping the lid margins very, very clean. Some patients need lid surgery, and some patients need laser surgery. So depending upon the evaluation, which is the only way you can determine which type of dry eye you have and how severe it is, that's when we can prescribe the options.
And what type of results would you feel are now available based on the many treatment options that you have available to eliminate the dry eye syndrome? What are we looking at results-wise?
Well, results-wise, if a patient has a more of a marginal to a mild dry eye, the success rate is almost 100% for those patients.
Very impressive.
If they're treated properly with the right medication and in the right sequence. And let me explain, sequence is very important. A lot of doctors think you just prescribe certain medications, whether it be eye drops or oral or topical eye drops. But there's one more factor involved, the sequencing of them. For example, if a patient has an evaporative dry eye and an aqueous deficiency dry eye, you always have to treat the evaporative dry eye first. Okay. If you try to treat it the opposite way, you will not be successful. So getting back to success rate, prognosis we call it, marginal to mild dry eye treatment, when done properly in the proper sequence, it's almost 100%. When you get into a moderate dry eye, the success rate is probably around 80 to 90%. Severe dry eyes, between 20 to 50%. So as you can see, the severe dry eye is the most difficult eye to treat, and these are the individuals that have very, very severe symptoms.
And how long would the treatments typically take? Again, I'm sure it varies based on each particular patient and his or her needs and how severe the problem is. But in general terms, what are we looking at?
That's a great question. The unfortunate thing is, once you have a dry eye is a lifelong eye disease. Okay, there's no cure for dry eyes. We only can manage it properly. The great thing about it is, if you have a marginal to mild dry eye, you might only have to use 1 or 2 options to treat the dry eye for the rest of your life. When you have a moderate dry eye, you might need 1 to 3 things, and severe, you might need 4, 5, 6 things, 4 options. But the most important thing the patient has to understand, this is a lifelong disease, comparable to diabetes or hypertension. There's no cure for hypertension, there's no cure for diabetes, and the same thing goes for dry eyes. It's a lifelong disease.
Okay, then it's just a matter of, as you mentioned earlier, how best to control it, minimize it, and effectively treat it with the options that you've already educated us.
We manage it properly, and part of the management is for the patient to return back to the doctor's office to make sure they're being managed properly. So it might be, once we formally have things under proper control, they might have to come back once a year or once every 6 months, depending upon each case.
Now, again, we only have a few moments left, Dr. Asman, and certainly you and your practice, Asman Eye Care Specialist here in Timonium, Maryland, have developed a reputation for excellence within your field and specialty. And I wanted to ask you, what separates you and your practice apart from so many other eye care specialists in this region?
Great question again. Again, most patients think dry eyes across the board for everybody. It's treated the same way, and as I just told you earlier, each dry eye patient is treated in a different way depending upon their exact diagnosis and severity of their condition. What separates us from the other eye care practitioners is our commitment to the treatment of the dry eye patient. My partner, who happens to be my brother, have been partners, and we founded the Dry Eye Center of Maryland back in 1977. And so we've been doing this for a long time, so we have the experience, we have the commitment, we have the passion, we love helping patients out. We have the technology that goes along with this. When new technology comes out, we instantly, after doing research, we buy the new instrumentation. We stay up with the research, we travel a lot for education, going abroad and in the US. So, and we have a team of support team here of technicians, receptionists, and doctors that work together, primary for the what's best for the patient's interest.
Well, you certainly are state of the art as far as technology goes. You can just tell by looking at everything you have here in this beautiful location of yours, not to mention the vast experience, as you touched on, since 1977. You all have been here helping many patients, and you certainly have many, many testimonials, Dr. Asman. In fact, if I'm not mistaken, a number of them are on your website for potential patients to review and look over.
Yes, anytime a patient sends a testimonial, and we have hundreds of them, we put them on our website for other patients to see how successful our practice is, and then there's hope for those patients out there that are suffering from a severe disease of dry eye.
Yes, indeed. And on that note, I'd like to thank you again for joining us and being a guest on our program, Dr. Asman. It was our pleasure.
Great, and thank you very much for having me. I
Thank
appreciate
you.
it. Great.